At a time when COVID cases are continuously rising in India, crossing even the 90,000 mark in last 24 hours. The central government held a very important review meeting with the states as well as the union territories, and the primary agenda of this meeting was to understand the health infrastructure and also the availability of oxygen, the oxygen equipments, whether it be the concentrators, the ventilators, the oxygen equipment of all category. So this was the prime agenda that was taken into account while the central government held a very important meeting with the states. And the clear message that was given to the states that it is the primary responsibility of the states that they need to ensure the availability of oxygen, the concentrators, the ventilators and several other allied infrastructure that need to be taken into account while combating with the rise of Omicron cases in India. The central government has also said that whatever the funds that are allocated to fight against the COVID, so these funds should be optimum utilized by the states, and the states need to apprise of the availability also if in case they need any additional support from the central government. In addition to this, the central government has issued a revised guideline related to the home isolation, and as per the revised guideline, all the international arrivals, all the passengers, those who are coming in India, they have to mandatorily undergo a 7-day home quarantine, and post these 7 days of home quarantine, on the 8th day they have to undertake a RT-PCR test. Also, the central government has revised the number of the countries which falls under the at-risk category. So as per the revised list, currently there are 19 countries which falls under this at-risk category, and these include countries like UK, Hong Kong, China, Zimbabwe, Botswana and majorly the African nations. So the passengers who are coming in from these at-risk categories, they have also to take a RT-PCR test on the 8th day, and if the test result says that it is still positive, then those samples need to be sent in for genome sequencing. So all in all, central government is trying to bring in more restrictions, more strict measures to curb the spread of COVID in India, and the states have been advised to properly coordinate with the central government in this fight against the rise of COVID or the Omicron cases.